Have you ever experienced a severe headache that you can't explain? Could it be a migraine? If you've ever found yourself asking these questions, you're not alone. Migraines, characterized by intense, debilitating headaches, are a common health condition affecting millions worldwide. But what exactly is a migraine? Think of it as an overly sensitive alarm system in your brain. When this system is triggered, it can cause a throbbing pain, usually on one side of the head, and sometimes accompanied by nausea, vomiting, and extreme sensitivity to light and sound. These episodes can last from a few hours to several days, disrupting the daily lives of individuals and often leading to significant distress. Despite being so common, migraines are often misunderstood and underdiagnosed. Today we're going to delve into the world of migraines, exploring its various aspects from types, symptoms, and causes to diagnosis, treatment, and prevention strategies. In the next few minutes, we will unravel the mystery of migraines. Not all headaches are created equal. Some are like pesky flies, others like a hammer pounding at your skull. But migraines, they're a different beast altogether. A migraine isn't just a bad headache. It's a neurological condition characterized by intense, debilitating headaches. When differentiating migraines from other headaches, two key factors stand out: the symptoms and the duration. Unlike regular headaches, migraines often come with a suite of unpleasant companions. Think nausea, vomiting, or sensitivity to light and sound. And then there's the pain, often described as a pulsing or throbbing on one side of the head. The duration is another telltale sign. Most headaches will bid you adieu in a few hours. But a migraine, uninvited, decides to stick around, typically between 4 to 72 hours. Recognizing a migraine from a regular headache isn't just about knowing your enemy. It's the first step in effective management. Because to tackle a beast, you first need to know what you're dealing with. Migraines are not a one-size-fits-all condition. While it may seem like migraines are straightforward, they're actually quite complex, with different forms and variations. Let's delve into the two main types, common and classic migraines. Common migraines, aptly named as they account for nearly 80% of all migraines, are characterized by throbbing pain on one side of the head, often accompanied by nausea or sensitivity to light and sound. They can last from 4 to 72 hours. And the kicker? They occur without any warning signs. On the other hand, classic migraines, also known as migraines with aura, present a different story. Prior to the headache, individuals experience an aura, a series of sensory disturbances that can include visual flashes, tingling, or even difficulty speaking. This type of migraine makes up about 1/4 of all migraines. Knowing the type of migraine can guide the treatment approach. Understanding the differences between these types is crucial for effective treatment, tailoring strategies to each individual's experience. Diagnosing a migraine is not as straightforward as it seems. Although there's no definitive test for migraines, your healthcare provider can use a variety of methods to diagnose this condition. They'll start with a thorough medical history and a physical exam. They may ask about your family history, the frequency and intensity of your headaches, and any medications you're currently taking. Laboratory tests like a complete blood count or liver function tests can help rule out other conditions. Radiologic tests such as CT scans or MRIs provide detailed images of your brain, which can be useful in ruling out other causes of your headaches, such as tumors or bleeding in the brain. In some cases, your healthcare provider might also recommend an electroencephalogram, or EEG, which measures the electrical activity in your brain. It's important to remember that these tests are not used to diagnose migraines directly, but to exclude other possible causes of your symptoms. A correct diagnosis is paramount to effective treatment. Migraines are more than just a headache. They come with a host of other symptoms that can dramatically impact your day-to-day life. One of the most common signs is an aura, or a visual disturbance that might appear as flashing lights, zigzag lines, or even temporary loss of vision. This usually occurs before the headache begins and can act as a warning sign. Alongside this, many people experience nausea or vomiting, which can be made worse by physical activity. Sensitivity to light, sound, and even smells is also common, often leading individuals to seek out a dark, quiet space until the migraine passes. Other symptoms can include a throbbing or pulsing pain on one side of the head, lightheadedness, and sometimes fainting. Some people might also experience changes in mood or behavior before a migraine, such as feeling unusually energetic, irritable, or depressed. Being familiar with these symptoms can help you identify when a migraine is coming on. Migraines can have far-reaching effects on your health. While they may seem like just a severe headache, migraines can lead to complications if not properly managed. One such complication is chronic migraine. This isn't just a one-off headache, but rather a condition where headaches occur for more than 15 days a month over a 3-month period. Another complication is status migrainosus, a serious and rare condition where a migraine lasts for over 72 hours and doesn't respond to treatment. This can be especially debilitating and requires immediate medical attention. Lastly, there's persistent aura without infarction. Aura refers to sensory disturbances that often precede a migraine. In this condition, these disturbances last for more than 1 week without any evidence of stroke. It's rare, but it can happen. These complications make it clear that migraines aren't just a nuisance, they're a serious health concern. Understanding these complications can help you manage your condition better. Why do some people get migraines and others don't? This question is often puzzling, but let's delve into the risk factors and causes of migraines to clear things up. Firstly, genetics play a significant role. If your parents or siblings have migraines, there's a higher chance that you may also experience them. Secondly, environmental factors can trigger migraines. These include changes in weather, strong smells, bright lights, or certain foods and beverages. Age is another risk factor. Migraines often start in adolescence and peak in your 30s, then become less severe later in life. Gender also plays a role, with women being 3 times more likely to have migraines than men. This may be due to hormonal changes, especially around the menstrual cycle. Certain medical conditions, such as depression, anxiety, bipolar disorder, sleep disorders, and epilepsy, can also heighten the risk of migraines. Knowing these risk factors can help you understand why you're experiencing migraines. While there's no cure for migraines, they can be managed. Now that we've understood the causes and symptoms of migraines, let's delve into how they can be managed and treated. The main aim of migraine treatment is to reduce the frequency, severity, and length of the episodes. This is typically achieved through a combination of medication and lifestyle changes. Over-the-counter pain relievers like ibuprofen can be effective for some, while others may need prescription medications specifically designed to treat migraines. In addition to medication, lifestyle adjustments can also play a crucial role. Regular physical activity, a consistent sleep schedule, and a balanced diet can all help reduce the occurrence of migraines. Stress management techniques such as meditation and yoga have also been shown to be beneficial. Remember, it's important to consult with a healthcare provider to find the treatment plan that works best for you. Effective management can help reduce the frequency and severity of migraines. Can you prevent migraines from happening? The answer is yes, to an extent. While we can't always control the onset of migraines, we can take steps to mitigate their frequency and severity. Here's how. First, identify and avoid your migraine triggers. These can include stress, certain foods, lack of sleep, hormonal changes, and even weather patterns. Keeping a migraine diary can help you pinpoint what's setting off your headaches. Next, maintain a healthy lifestyle. Regular physical activity, a balanced diet, and adequate sleep can do wonders for your overall health and potentially reduce the occurrence of migraines. Also, consider stress management techniques like yoga, meditation, or mindfulness. These practices can help keep stress levels in check and possibly lessen the impact of migraines. Finally, don't underestimate the power of regular medical checkups. Your healthcare provider can offer personalized advice and treatments to help manage your migraines effectively. Remember, prevention is always better than cure. So, take control of your health and make these preventive steps a part of your daily routine. Migraines can be a complex condition, but understanding it can make a big difference. We've ventured through the maze of migraines, distinguishing them from other headaches and identifying their various types. We've delved into the diagnostic procedures, from laboratory tests to radiologic examinations, which can help confirm the presence of this condition. We've also explored the signs and symptoms to watch out for and the potential complications that can arise if left unmanaged. We've identified who is at risk and what might trigger these debilitating headaches. But most importantly, we've shed light on the plethora of management and treatment options available. Prevention has also taken center stage in our discussion, underlining the importance of lifestyle modifications and proactive measures. Migraines may not be completely curable, but with the right knowledge and tools, you can manage them effectively. Remember, you're not alone in this journey. With the right knowledge and tools, you can manage your migraines and live a healthier life.